Today, we're going to talk about 3 common mistakes that I see people make all the time when choosing their healthcare plan. Sometimes trying to save money on your health insurance can actually cost you a lot more in the long term. So these 3 mistakes that I'm going to go over they're all pretty much, they happen because people are looking to save money, but then they make the wrong choice. So number 1 is health shares. Health shares are not real insurance. Health shares are not guaranteed by an insurance company. And so they work for a lot of things. Typically, people will get these because they're cheaper, especially if you have a larger family. They tend to be cheaper. A lot of these you have to prove or show that you are religious based for a certain religion, like Christian health shares. And if you show that, then you can qualify for one of these plans. They're not underwritten the way that private PPO comprehensive plans are. And they have limitations. So they tend to be like pretty decent if you ask people who've been on them but never had a major health crisis, and let's say they had a baby. A lot of these really support maternity and covering the baby, so they're okay for maternity. And if you have claims that are under $30,000, they're typically okay too. But there has to be voting in order for them to decide like if these claims are actually going to get paid, and a lot of them do reimbursement, so it doesn't work like a real insurance plan, and so there are limitations to it. Number 2 are short-term plans. Short-term plans have actually gotten a little bit better over the years, because now, whereas like years ago, it used to be that a short-term plan could be no longer than 3 months, and so it would have to renew every 3 months. Now they can be 12 months, and some even will guarantee your rate for up to 3 years, which is really great. And typically they're also on the cheaper side, but they do have some limitations. A lot of these short-term plans are underwritten, but they're not underwritten on the front end of the plan. They're underwritten on the back end of the plan. And that means that it's a little bit easier to get onto the plan and to get accepted. It's not like such a velvet rope. It's not so exclusive. So it's easier if you have some underlying health conditions to get accepted for the plans. But the problem with that is that if you do have a big claim, that claim is underwritten on the back end, which means that it leaves it in the insurance company's hand and to decide like whether they're going to cover and pay out on that claim. They can actually deny coverage on the back end. So that's a huge limitation. And also it can, it might be okay for like maybe 15 to 45 days if you have a real small gap between, let's say between jobs and you're relying on employers for health insurance. It could serve you, but it's still a little bit of a risk, especially if you're going to go longer than a couple of months on one of these short-term plans. Another thing with short-term plans is if you're going to stay on them like a little bit longer, and let's say you do want one of these, if you're going to be self-employed and you want one of these for the long term, what happens with the short-term plan is, let's say they give you the rate for 12 months, it's underwritten for 12 months, right? At the end of the 12 months, it doesn't just renew and your rate goes up. It doesn't work that way. You actually have to go through underwriting again. And so now the insurance company gets to decide whether or not they'll take you. So, and they'll take your claims into consideration. So if you got sick or you had some funny claims or something that they don't like, or they had to pay out too much, they can choose whether or not they want to re-accept you for that next 12 months. So that's one of the limitations. And number 3 are multi-plan PPOs. Now listen, there's nothing wrong with multi-plan PPOs. I have a few clients that these were the best options for them because it's all that they would qualify for and that there was available to them timing wise, as far as like whether they could enroll in the marketplace or not. But in reality, these multi-plan PPOs, yes, they give you the nationwide coverage, and so they're great for a lot of like travel nurses or truck drivers. If you're constantly working across state lines, they're good for that. But typically, if someone's on these, it's because they couldn't qualify for an underwritten PPO plan that's actually going to give you that comprehensive coverage. So a lot of these multi-plan PPOs, they have good day-to-day coverage for the everyday. They give you the multi-state coverage, but they have limitations and maxes as to what they'll pay out if something happens. So if you have something really major happen to you, and you're hospitalized for a long time, you could end up with a lot of money out of pocket because these plans are really not designed to keep long term. So you may be asking, Alex, what are my options? I'm in this situation and these seemed okay, but what do I do? reach out to me. I will tell you the best solution for you, and also tell you the limitations of any solution that you even are looking at, just so that if you can make a totally empowered choice, that you know what the limitations are, that you're willing to risk any risk involved with any plan that you choose. And it's really important to do this because sometimes marketplace is the best option. I usually tend to like turn to the private plans that are underwritten, but if you have health conditions and you're looking to save money, it could be that we can look at doing something on the marketplace and putting together something creative, a creative solution with supplemental coverage, with an association-based plan. There's so many different options. And so reach out to me. You can find me on alexthehealthagent.com. I'd be happy to help you. And my services are free to you because the insurance companies pay me. You can also follow me on Instagram. I have lots of educational videos that you can watch before you reach out to me. And if you like this video and it was helpful to you, please share it, comment, and like it.